Mr. Speaker, for many years, this NDP government's mismanagement of child welfare in Manitoba has gone from bad to worse. They continue to have families torn apart instead of providing support for families and children to reduce apprehensions. Our report last year reinforced this, as did the Hughes report. Today I table a FIPA showing that the number of children in care is 10,435 children. That's as of December 31st. That's more people than live in the entire city of Selkirk. Why has this NDP government continued to ignore expert advice that we need to address the root causes of child apprehensions? Can the Premier explain how he plans to turn these numbers around?
The member's question is a very important question, Mr. Speaker, and one child in care is too many children in care. We want child to be at home with their families. We want them to be in their communities. We want them to have that experience that all children deserve, which is to be raised in a loving home. And where that's not possible, occasionally and far too frequently, they are brought into care, Mr. Speaker. Many of those children in care now are over the age of 18. The Children's Advocate recommended that they continue in care after 18, whereas before they used to be just left on their own to their own devices. So we have retained more people in the system in order to provide them proper transition to adult life and independent living. But even with that, Mr. Speaker, there are too many children in care, which is why we have made a very significant investment in prevention. Which is why we've put another 280 workers on the front lines to work with families in their communities. And the long-term solution, Mr. Speaker, is to have strong communities where there's jobs and employment and support for families, and to ensure that we have good schools where children can get an education. And those are the things we're investing in, Mr. Speaker. And the members opposite always want to slash those services, and the member from River Heights always votes against the investments we make in those very things which strengthen family life, Mr. Speaker.
Mr. Speaker, to implement some of the Commissioner Hughes' recommendations, the government issued an untendered contract to AMR Planning and Consulting. The fact that the contract was untendered is not surprising with this NDP government. But Manitobans want to know what to expect from the contract. To prevent apprehensions of children, this province must move to a child and family services system that provides far more support for children and families. But we don't know if the NDP government instructed AMR to achieve this goal. I asked the Premier, did he instruct AMR that the goal is to support families and reduce the number of children apprehended into care? And will the government table these detailed instructions today?
Speaker, we had detailed recommendations from the Hughes inquiry. Numerous recommendations, all of which are being considered and reviewed for implementation. Many of them are underway as we speak, Mr. Speaker. And the Hughes Commission of Inquiry said there was very significant progress being made in Manitoba. But they said there's more progress that can be made. We've accepted those recommendations. The implementation team will be working closely with the child welfare authorities. They'll be working closely with the professionals in the system. We'll be working closely with those organizations as well as the communities where children and families live, Mr. Speaker. So the approach is to ensure that the child welfare system puts the welfare of the children as the #1 priority and provides supports to families in the aid of prioritizing child welfare. And we are working across Manitoba to build stronger communities with a steady growth in the economy and good jobs and a commitment to education and health care, all of which are at risk by the members opposite with their plans and the member opposite who refuses to support investments in families in Manitoba.
Mr. Speaker, the problem is the government's mismanagement of funds.
Absolutely.
Mr. Speaker, around Christmas time, as a special present from this NDP government, there was a drastic cutback in funding for all 4 CFS authorities for the remainder of the fiscal year, a funding reduction of 16%. As a result, the authorities that set their budgets according to this NDP government's funding promises 9 months before were forced to cut back support for families and for children, as this Free Press article I table indicated. Manitobans know that the NDP mismanaged the budget, but why are they using cutbacks to punish the very service they claim they want to improve?
Child welfare budget has gone up this year. It has gone up in all previous years as well. All positions are funded for frontline service in the province of Manitoba. Very different from what we used to call Filmin' Fridays, when people were forced not to work, to be laid off one day a week, essentially, and no service provided to families at all for 3 days every week, Mr. Speaker, and that was a very significant problem. So proper funding is there. It has been grown with respect to that envelope of support for families every single year. In addition to supporting child welfare, we made big improvements in funding for early childhood development, Mr. Speaker, this year in the budget. That is a prevention program. Early childhood development works with young families from the day of inception to ensure they get off to a good start. We increased funding for daycare, Mr. Speaker. Early childhood learning, daycare, makes a big difference for young people getting a good start in school. We've decreased the number of students in the K-3 area, Mr. Speaker, which allows children to get off to a good start in their education program. And we're looking after children after they reach the age of majority and have aged out of the child welfare system. We still provide them with the opportunity to be supported by child welfare workers in Manitoba. We care about children. We care about families.
The Minister's time has elapsed.